It's Columbia Morning on KFRU. I welcome into the studio a doctor from MU Healthcare, Jussuf Kaifi, and we're going to talk about lung cancer. Doctor, first of all, good morning. How are you?
I'm fine. Good morning, David.
Thank you for joining me. I want to start this. A week ago in the Kansas City Star, there was an article that was on the front page, and it started this way. Cancer rates in the country, according to an American Lung Association report that was released, I think, about a week ago. And it says the culprit, you can draw a straight line between lung cancer and smoking. We're talking about lung cancer, in particular detection of lung cancer, correct?
Yes.
So you were probably aware of those statistics. I think there are only 44 states, according to that article. We are worse than 44 other states in the instance of lung cancer in this state. How prevalent is it?
It's very prevalent. We are top 10 amongst the smoking rates in the whole country, due to the reason that cigarettes were pretty low tax in Missouri for quite some decades, and we are top 10 in lung cancer rates, in particular in central Missouri.
It says, oh, really? It's worse in central Missouri than other parts of the state?
Yes.
I saw it says Missouri was deemed to have, I think, 73.2, and I think that is that instances of lung cancer per 100,000 people?
Yes, that's the incidence rate, and we have a very high rate in central Missouri, in particular in the rural areas, because the smoking rate is so high. People start smoking really early.
So do you, as a medical doctor, a physician, try to prevent people from smoking, or is this something that you say, you know what, I don't know how to do this, let's just try to get the awareness out there to test yourself for lung cancer?
It's actually both.
Yeah.
Me specifically as a surgeon, I see patients once they have been diagnosed with lung cancer or they do have a lung nodule that we need to work up, and that's very stressful for patients, and sometimes that's not the right moment to advise on stopping smoking, although it's always the right moment to stop smoking. So we do talk to patients about stopping smoking because it's never too late to stop.
So what are you saying to those who haven't had any lung cancer diagnosed? What is the message to people who have been smoking for quite some time?
Yeah, if you have been a heavy smoker, you can undergo lung cancer screening now, which is very new, based on a large trial on over 50,000 people in 2011. And if you undergo a low-dose CT scan, a CAT scan that has pretty low radiation exposure, if you undergo that one, you can reduce your risk of lung cancer by 20%. And it picks up early lung cancers. Now it's an annual screen, and it's very effective.
Who are you suggesting gets this? How young of a person? Is it based more on cigarette usage or usage than age?
Yeah, it's based on age. You should be older than 55 and not older than 80. And it depends on your smoking history. If you have smoked 30 pack years, that means you have smoked 1 pack a day for 30 years or 2 packs a day for 15 years. So 30 pack years smoking history, and you haven't stopped in the last 15 years, then you are eligible for a low-dose CT scan, and the insurance actually pays it.
Oh, it does?
Yes.
So if that shows maybe the beginnings of lung cancer, what happens next?
So once we see a nodule, it gets sometimes pretty complex. Most of the nodules that we see on a CAT scan are not lung cancer, fortunately. So we always tell patients not to be too anxious. But sometimes it can be lung cancer, and then we work it up, sometimes with a biopsy, sometimes we remove it right away. The good thing is that we can pick up cancers really early. Most lung cancers get diagnosed at a late stage, and then we can't cure it anymore. But with these scans, we pick it up real early.
So what happens if it's a late stage? What are the conditions that people start to recognize that would lead you to say, well, you have advanced stage of lung cancer? I guess what are the symptoms is what I'm asking.
Yeah, it's mostly cough. You can cough up blood. You can have weight loss, shortness of breath, recurring pneumonias that you need to be treated again and again. These are the signs of advanced lung cancer.
What's the difference between COPD or emphysema and lung cancer?
There is an association between emphysema, which is commonly caused by smoking, and lung cancer. So you have a higher risk of lung cancer if you do have emphysema or COPD. We kind of bundle it together.
Yeah, one doesn't necessarily mean you have the other, though. I mean, my dad died from COPD. He died from emphysema. He smoked a lot, so he didn't have I don't think he was ever diagnosed of lung cancer, but he did have the breathing problems, because the only reason I brought that up is the symptoms that you talked about, coughing and shortness of breath and weight loss and everything like that goes along with emphysema and COPD too, I think.
Absolutely, David. You're absolutely right. These are the similar symptoms. And what you need to do then is to probably undergo a chest x-ray first if you have these symptoms, and then a CAT scan. And that tells you whether somebody has emphysema, because that's a radiographic diagnosis. And if you have a lung mass in addition, you may have a lung cancer.
Are you saying to those who are 55, between 55 and 80, who have smoked a lot in their life, 1 pack a day for 30 years or 2 packs for 15 years, yearly they should be getting the low-dose CT scan on their lungs?
Yes, absolutely. And, the recommendation that we give to people is depending on the result that we get from the first scan. If there's something that needs to be followed up more closely, then we would patients, come back in 6 months. And they have very detailed guidelines.
You mentioned that you're a surgeon. So do you remove parts of the lung in your job? Do you transplant lungs? I think I saw just over the last few days a very young person of 17 years old who his lungs were destroyed apparently by vaping, had a double lung transplant.
Yes, at MU Healthcare, we do not currently do lung transplantations, although, me and my partners, we're trained in it. We mostly treat lung cancer and metastatic disease to the lungs from other cancers, but the big bulk of our practice is lung cancer, and then we typically remove part of the lung.
So how often do you do that? I'm just curious as to when it gets to the advanced stage, and when do you decide we can do this and prolong someone's good quality of life?
So advanced lung cancer means it has probably spread to other organs already. That's nothing we would treat surgically. We would treat this with chemotherapy, neuroimmune therapies that have gotten really efficient. As surgeons, we see the earlier lung cancers. That means they are localized in the lung. Sometimes they have spread to the local lymph nodes within the lung, and then we remove that part of the lung, which is usually a lobe. We call it a lobectomy, and we remove the lymph glands as well. And we can do this minimally invasive now, robotically assisted, and patients recover real quick. Some patients go home even the next day these days.
Wow. How close are people in the research field able to say, how can somebody smoke all their life and never have lung cancer or COPD problem, and then others, it's more likely that something will occur to your health if you're a heavy smoker rather than it won't? Those are exceptions to the rule.
This is a great question. Most people who smoke do not get lung cancer. It's around 10% chance. So it's really interesting. We don't know. What probably is one of the reasons are genetic factors, because there are 20% of people who never smoked and they still can get a lung cancer, in particular women. So there are probably many genetic factors, and some of them we know already, some of them we don't, and this is part of research endeavors.
Will CT scans ever be part of a regular, I don't know, I guess you ask the history of people and find out if there was lung cancer in the family, and then would you ever consider then, do you think there'll be a point where people are going to be having low-dose CT scans if they're perhaps prone to having lung cancer?
I think so, and I think the criteria are getting less strict now, in particular if there's a strong family history for cancers in general and lung cancer specifically in never smokers. That may come in future, yes.
So what would you like to leave with people? What would you tell people then, the takeaway from this interview?
I think the takeaway is stop smoking if you can. Seek advice with your family physician to undergo maybe a smoking cessation program, because that really decreases your risk of lung cancer. If you have a strong history for smoking, see your family physician as well and get referred to a lung cancer screening program, get a low-dose CT scan if you're older than 55, and then you might be cured early.
Again, the cure for this, short of surgery, is to stop smoking, and what else?
The cure is to stop smoking and get treatment early, which could be surgery or radiation, sometimes as well.
It's a lot of this, not all of it, a lot of this is preventable.
Yes.
Just don't start smoking.
Yes, 80% of lung cancers are preventable by not smoking.
Well, appreciate your advice today. I just go one more thing to the CT scan. Those that are listening, I think they think they're slid into a tube. Is that basically what this is, or is there a different way to do a lung CT scan?
There are CAT scanners, I think, that you can do in a standing position. Most of the time you slit through a tube, but I can tell you patients do real well. It's very quick, and it's not a big deal.
No, you know what? I've had a few of those over the past summer, so but not for that, not for what you're talking about. Doctor, I really appreciate your time today. I hope people heed this because, again, the thing about it is I think many people know the dangers of smoking, but it's hard to stop. It's for those who are doing it, it is hard to stop. Absolutely. And sometimes it takes something drastic to get them to stop. And maybe it takes this interview today to have people stop doing it because it's sad that, again, as you said, here in mid-Missouri, especially in the rural areas, there's a high prevalence of lung cancer brought on by smoking. Doctor, thank you.
Well, thank you, David.
Dr. Jussuf Kaifi has been our guest. You're listening to KFRU.